Hello everyone, welcome to the SnotDoc video series. My name is Dr. Stephen Chase. I'm an ear, nose, and throat surgeon out of St. George, Utah. If you have a teenager who's just had their tonsils out, then this video is for you. We'll go over the unique challenges that this age group tends to experience during the recovery period. So tonsillectomy in the teen years is truly a unique experience. These kids are obviously transitioning through puberty into adulthood. And so our approach to caring for them in the postoperative period is moving more towards that of the approach that we use for adults. Pain management specifically is going to be changing, and teens sometimes have stronger side effects from these that we'll talk about. So today I also want to go over specifically the pain management, as I mentioned, eating and drinking, ear pain, want to touch on nausea, and then again talk about bleeding. So when it comes to pain management, I like to break it up into both systemic and topical therapies that we can use. When we talk about systemic treatment, we're really talking about pills and sometimes liquids that you'll use. The most common thing, again, are these NSAIDs or non-steroidal anti-inflammatory drugs. For the most part, you're going to be talking about Tylenol and ibuprofen. Generally, in the teen years, over age 12, we start to also introduce some narcotic pain medicines. Typically, then we will alternate these with ibuprofen. The narcotics that are used are generally hydrocodone, usually in combination with acetaminophen or Tylenol, or oxycodone, also in combination with Tylenol. Typically, the approach then would be to do an ibuprofen, and then 3 hours after that, use the narcotic. 3 hours later, then you're using the ibuprofen again and moving forward like that. I typically recommend doing that fairly consistently for the first day or two, trying to stay ahead of the pain, get a feel of where they're at. Your teen will get a feel of where they're at from a pain standpoint. And of course, as soon as you feel like it's possible that they can start to back off, I recommend doing that. When it comes to narcotics, there's two significant side effects that your teen may experience. And again, it seems to potentially be a little bit more common in teenagers. The first is nausea. The second is constipation. So the nausea can be significant. Often what's recommended if you experience that is to go slow. If possible, if they can take the medication with something on their stomach, then that usually helps. The other thing that can be done is you can have an anti-nausea medication given 30 to 45 minutes before the narcotic to kind of be in their system to blunt that response a little bit. Typically with that approach, your teen would be able to handle the stronger medication, but occasionally not, and it may be that you'd have to just move away from that and just do extra strength Tylenol alone. The other side effect is constipation. Obviously never a good time, especially when you're feeling sick from having your tonsils out. Because of this, whenever I have a teen and adult start narcotics, I typically recommend that they start some over-the-counter stool softeners just to try to avoid that. Now, in talking about the topical things to do for pain, ice, of course, is going to be my go-to. Keeps inflammation down, tends to numb the nerves a little bit, hydrates a little bit too. So always going to push the ice. Then I would break these other topical things up into medications or things that can try to numb the nerves, and then things that just coat that surface and try to hide the nerve endings and the ulcer. So the things that you can get over the counter to numb the nerves are some lozenges that typically have menthol in them, maybe some benzocaine. There's some sprays as well with phenol, things like that can be just purchased over the counter. There are also medications which your surgeon can prescribe, which have some compounded numbing medications in them. Now, I would encourage you, of course, talk with your surgeon about these. Each surgeon is a little bit different on what they do and don't like to use when it comes to these topical medications. When it comes to those that are more of a coating approach, the most commonly studied medication is called Sulcrafate. It comes in a name brand called Carafate, which is actually used for ulcers. But the way that this is used is typically a couple teaspoons about 4 times a day that your teenager would put in their mouth, kind of swish around, potentially gargle if they can, and then they could swallow it or else spit that out. The coating seems to help control the pain. I also encourage humidification. Just that little extra moisture really tends to go a long way. So if you have a humidifier, or if you need to purchase one, I recommend that. Put that by your teen's bed and just run it. Again, that extra humidification can really go a long way. Okay, so when it comes to eating and drinking, the main thing that we're going to encourage with our teens is just hydration, pushing fluids really any way they can do it. Of course, popsicles, ice chips, anything like that is great. Um, the the way that you'll know if your teen is staying hydrated, they'll know, is really actually by watching their urine. The more concentrated it is or darker it is, it's kind of our body's way of telling us that we are a little bit dry. Of course, the opposite is true too. If the urine's pretty thin, then you're well hydrated. When it comes to eating, believe it or not, there's not a lot of restrictions. Typically, I recommend just maybe avoiding sharp things, pretzels, chips, but then also having them experiment with small amounts before they really take a lot in. All right, the next thing I wanted to talk about in the teen group is ear pain. This seems to be a little bit more common with our teens than potentially our young kids or even adults. We see it there, but it seems to be, at least in my experience, more common with teens. Believe it or not, the ear pain that they experience is not their ears at all. It's actually just coming from their throat when they have referred pain from the area where the ulcers are up to their ears. Very common. Take some comfort that they don't have an ear infection or things like that. It's just coming from their throat. But it can be significant. And so aggressive pain management, just again with alternating the non-steroidal medications with the narcotic is typically what's recommended. All right, another problem that we see not uncommonly with our teens is that of nausea. Certainly this can be related to the use of the narcotic pain medications, as I mentioned, sometimes even bad enough that they can't take them. The other time, of course, that we see this is in the brief period after surgery, which we like to blame on the anesthetic medications that are in their system. Typically, in that early period, I recommend if your teenager is experiencing nausea, just to really back off. Don't push fluid, don't push food, don't really push much of anything. Even giving them a couple of hours to just not try to take anything in, and then start to slowly put things back in their system. A lot of times that alone is all you need to do just to let things kind of clear and let their body settle. But if you're going several hours, you're 6-8 hours, and they're still struggling, I would communicate with your surgeon. They may want to call in some anti-nausea type medications. So bleeding, of course, is the thing that we are most concerned about in the postoperative period. Generally, this occurs in days 5 to maybe 10 after surgery when the scabs start to slough off. I generally tell patients you're going to see some. Expect it. When you do, grab the ice chips, grab the popsicles, maybe grab a bag of ice for the outside of your neck, or a bag of frozen peas or corn. And typically that is enough to kind of slow the blood flow, spasm the blood vessels, and get the area to stop bleeding. Occasionally it won't, though, where you've done all these things and your teenager's just bringing out more blood. And typically, they're going to let you know. So keep an eye on how much. I typically say teaspoon, tablespoon common. If you're getting 1/4 of a cup, maybe 1/3 of a cup, that's a little bit more than we anticipate. Still go with the cold, inside as well as outside. But generally, if you're hitting 1/3 of a cup or so, I'd recommend that you communicate with your surgeon or their office for their specific direction. If it continues even more than that or is much more brisk, generally they're going to be recommending heading to your local emergency room for evaluation there. All right, so good luck through the next week or so. Hang in there. Believe it or not, once you're through this, you're going to be glad they're gone. I often tell my patients that the best part about getting your tonsils out is that you never have to do it again. All right, well, hopefully this video was helpful for you. If so, please hit the thumbs up button. And of course, we'd love you to subscribe so you can see more of the videos in the series. If I mention any products during the video today as well, I'll try to include some affiliate links to those things below the video. So again, thanks for watching, and until next time, keep your nose clean.